Content warning. Following content retains real images of the asylum and language that would now be considered derogatory in modern day but was used professionally in history. There will also be jumps in how the hospital and patients are referred to, as many documents refer to the hospital by different names, and mental illness was not widely accepted. It's the year 1866, and Iowa's mental hospitals are overflowing with soldiers who've returned home from the Civil War with trauma not quite understood, and Iowa's hospitals would not take more patients starting in the fall of 1865. Soldiers sent there from Minnesota were being returned with nowhere to go. That's where the State Hospital for the Insane came in. On July 1st, 1866, in St. Peter, a 210-acre farm was bought for $7,000, and the space began being used for the hospital. Prior to the government providing facilities for treatment of people with mental illness, there had been advocates to provide such buildings. One individual, by the name of Dorothea Lind Dix, was a notable figure in this advocacy work. In 1848, Dix appealed to Congress asking them to help fund and provide facilities that would help treat and take care of people with mental illness. She was reported as saying,
"More than 9,000 idiots, epileptics, and insane in these United States, destitute of appropriate care and protection, bound with galling chains, bowed beneath fetters and heavy iron balls attached to drag chains, lacerated with ropes, scourged with rods, and terrified beneath storms of profane execrations and cruel blows, now subject to gibes and scorn and torturing tricks, now abandoned to the most loathsome necessities or subject to the vilest and most outrageous violations."
After going back and forth for a while, Congress passed a bill in 1854 that allowed public land to be bought and for the funding of mental hospitals to be built. However, President Franklin Pierce vetoed it because he had feared that the funding for taking care of the insane would be the federal government's problem to pay, rather than the state and local governments. Advocates for the mentally insane began to shift their attention more to state and local governments, putting pressure on them to provide living facilities and treatments. Minnesota in 1862. Officials began looking for places to house the people deemed insane, as those who were considered insane were often locked inside their own homes. Those considered violent were often shackled or tied up in secluded rooms. Those who could not stay with families would often end up being stuck in poor country farms or jails. St. Paul was also dealing with an ever-increasing number of insane persons. In 1861, Iowa opened a mental hospital in Mount Pleasant that has accepted 55 patients from Minnesota, till 1866 when they needed that space back, as they were over capacity. They sent those patients back to Minnesota, except for some cases. Regardless, Iowa refused to accept more patients from Minnesota. Minnesota, in turn, easier to control and manage. Conditions in the Ewing house were not good. While remodeling the building, it was not taken into consideration that it may be a bad idea to have the main source of water near the privies, which caused contamination to the well. This well had consistent water flow problems that would frequently have to be dug out. Side note, sewer systems weren't added till about 1906, so waste was often emptied out into the streets. During this time, a man named S.D. Flagg was a physician and secretary on the Board of Trustees, and he oversaw managing admission and discharge of patients. He hated this job, as he was frequently overwhelmed by letters from families and orders from other facilities saying he would discharge people early, or why didn't he take patients, so on and so forth. Dr. Flagg welcomed his chance to resign from the Board of Trustees, which he did in a meeting during spring of 1867. Samuel E. Shantz was a physician in the field of mental health. He had been a well-known member of the Association of Medical Superintendents and American Institutions for the Insane. He initially was hired as both the superintendent and steward of the Minnesota Hospital in October 1866, and Miss Mary L. Paxton was elected Martin after Dr. Shantz recommended her. In February 1867, George W. Dreyer was hired to take over the steward position. The Minnesota Hospital for the Insane officially opened its doors to its temporary quarters in the middle of winter, December 6, 1866. Patients began to arrive. 18 patients were incurable, returned from Iowa on December 28th, while others began arriving from St. Paul Jail, where they had spent a long time there and arrived in poor condition. One patient was noted as being covered in lice. Additional staff were hired during this winter as well. Within 3 months, there was a report of an inspection that implied that the group of patients were well behaved and the surroundings were comfortable. There were about 21 male patients, 28 female patients, and 2 children. The report mentioned only one patient was restrained, but also that the water closets didn't work well due to the lack of water. By the spring of 1867, overcrowding and lack of space was already apparent. A push for a permanent hospital began to handle the overcrowding. In 1867, $40,000 was provided to construct a permanent hospital. Initially, $50,000 was asked by the Board of Trustees and legislature. However, the trustees determined that they should build an additional building, which would be 2 stories with a basement. It cost over $6,000 to build this temporary building. This was important to the board as all present buildings were full. Patients were being brought over hundreds of miles only to be taken back. The temporary building was a 2-story high, 96-foot by 34-foot building and had a stone basement. It was heated by a large furnace and had decent furniture. It was said to be more comfortable than some of the older buildings. The trustees didn't want to keep building more temporary buildings. At this time, they could only accommodate about 100 patients and had 82 with 20 applicants. The Board of Trustees put pressure onto legislature to assist with meeting the demand of suffering humanity, as they did not think that a permanent hospital will be ready for occupancy earlier than the fall of 1869. The permanent hospital began being built in the summer of 1868 and finished in 1876. This hospital followed the Kirkbride linear design. The Kirkbride design works. The way Kirkbride design works is you have a center building that would host a kitchen, dining rooms, storerooms, and apothecary shop in the basement. The offices, parlor, and private rooms for assistant physician, steward, and matron on the 2nd floor. On the 3rd floor, there would be a superintendent's private apartments and a chapel. On the 4th floor is where the bedrooms for the domestics of the institution would be. The Board of Trustees frequently had requested more financing for the build as they ran into unplanned issues, like how the ground was extremely rocky, so there would need to be costs of breading in the ground. There would also be the need to build a power supply and other necessities that would go into construction. An architect of Samuel Sloan estimated the cost of the center building to be $195,000, and the cost of the wings another $100,000. The cost of excavation and mansion work done on the center building cost $7,517.19. It was clear to the building committee that they would need more funding to even come close to building the permanent hospital. Dr. Schatz reported on February 5th, 1867, that the Ewing building was already crowded and dirty. It was determined that more patients would not be accepted in. However, many people sought admission with tales of suffering. However, he would have to turn them away. By May 30th, 1867, Dr. Shantz reported the number of patients had run up to 56 and had 30 applications pending. He reported that he assisted in the drawings of the plan for the temporary building that could house another 50 persons, that was then ready for occupation in October. He reported how this helped with the overcrowding of the previous building and allowed him to accept more applications. However, once people realized there were more provisions being provided, more people came to try to be admitted without making previous applications. He believed this temporary building would be full by February 1868. He reported at this time in 1867 that 97 patients were admitted during the year, 13 discharged, 10 recovered, 2 died from epilepsy, and the other from apoplexy, and 1 eloped unimproved, with 84 patients remaining. Superintendent Samuel Schatz died in August 1868 of typhoid fever after he had examined a woman who had typhoid fever who died in July 1868. The next superintendent was Dr. Cyrus K. Bartlett. Then there were the sections and wings, which were 3 stories high and a feet by 44 feet. This is where the patients resided. And in the back of the center building was where the laundry and workshops would be. The Kirkbride design was considered to be good for allowing light in and creating good airflow during a time when AC and heating weren't available like the luxuries of today. The design also allowed more wings and sections to be potentially added on. Dr. Thomas Kirkbride of Pennsylvania Hospital for the Insane had been in contact with the state and reviewed the plans for the Minnesota Hospital for the Insane. Dr. Kirkbride had approved the plans, believing it meets his requirements. Dr. Kirkbride commended the building's heating and ventilation arrangement. The center building was well decorated, and the patients began moving into the first wing on February 7, 1870, and the last wing in fall of 1875. However, this truly didn't stop the overcrowding issues. The temporary hospital buildings were always overcrowded and filthy. Patients were getting sick. The temporary hospital buildings ended their use in 1885. Before the permanent hospital became overcrowded, it was reported as extremely clean, bright surroundings, and well finished. Again, though overcrowding and the water closets were the biggest issues, the turnover rate of employees was high as well. There were reports of patients acting as staff as well. At this time of 1877, the hospital had a daily average census of 564 patients. On November 15, 1880, the north wing of the mental hospital caught fire. It was catastrophic, and many patients died. Dr. Bartlett resigned as superintendent in 1892, with many allegations of abusing patients, which is really a concern if it's the 1800s and they are calling his actions abusive. The hospital was above maximum capacity, even though other mental hospitals were opened up in Fergus Falls and Rochester. The mental hospital in St. Peter was the only one in southern Minnesota. Many patients became permanent residents due to their chronic and untreatable mental illness. During these time periods, mental illness was considered a shameful thing. Families would move away after dropping off a family member. There was a report of a wife leaving her husband there and moving states so she could still get a job, as being associated with the insane could cost you your career. Something unique about the mental hospital is that it had several activities that would help patients build skills for a workforce: farming, carpentry, sewing, cooking, instruments, etc. They had an on-campus farm and would assist in providing the food and taking care of the animals. Patients had the ability to become trusted over time, and their wardrobe would represent that. The more trust they gained, the more freedom they earned. Those especially trusted could visit the hobby shack by the stream as long as they came back at night. Treatment-wise, it was a while till medications were used, due to the science of psychology being so young. Treatments would include electrotherapy, hydrotherapy, restraints, physical activity, isolation, and a few others. They never did lobotomies on the campus, though they did have a surgical space and used the 4th floor to perform surgeries, since the light from the windows assisted them with that. Patients, of course, did die, and would often be buried in burial shrouds, as the clothes they would come in were often too small or too disheveled. These shrouds were to give them some dignity in their burials. The on-campus graveyard did lose the original headstones due to a fire, but volunteers worked to identify what they could and document as much as they could of the history and who was there. Cut to 1947. A report was made to Governor Luther W. Youngdahl on the conditions in the Minnesota State hospitals as a whole by Justin G. Reese and Mrs. Reese. The report covered the 7 mental hospitals, when there was a population of over 10,000, but still lacked clinics and only a handful of social workers. The report states that the public had failed to support these hospitals or demand improvement because science has made progress, but public opinion is still back in the Dark Ages, when mental illness was considered sinful or hopeless, and the mental patient viewed as a criminal or a brute. Mr. and Mrs. Reese's report stated Minnesota's government failed to provide enough funding to create good social work and decent outpatient services. It was prepared that the hospitals fall short of being able to meet the APA standards of having a minimum of 38 doctors, 340 nurses, 591 attendants, and 30 social workers. The report included several other things that the hospitals were failing to provide. Minimum personal hygiene of majority of the patients was neglected. Majority of patients received no routine physical examinations. Restraints were being substituted for treatments. Food and food service were of poor quality. Clothing was grossly inadequate. And many patients do not receive the care and attention which the state provides livestock on the grounds of these same institutions. Such a severe shortage of personnel was found across all hospitals in Minnesota, and this included the Hospital for the Insane in St. Peter. Hospitals at this time lacked funding. Overcrowding was frequent, and sickness spread like wildfire. There was a widespread use of restraints and isolating patients, most likely due to the shortage of personnel and the lack of proper treatments. Restraints were reported to be more commonly used on female patients than male patients. Things were not looking good for Minnesota mental hospitals. There was a talk about shutting down the St. Peter State Hospital. In 1982, they had a bed capacity of 674 and was operating at over 90% capacity. The locals and staff advocated for the continuation of St. Peter State Hospital for a number of reasons. At the time, they operated the only forensic psychiatric unit, and the hospital itself had over 700 employees. St. Peter State Hospital was the largest employer in St. Peter and accounted for 32% of all wages in St. Peter. St. Peter would also take in patients from 19 other counties. St. Peter State Hospital provided mental health treatment in southern Minnesota without patients having to travel several hours to another hospital. The hospital also housed mentally ill adults that were working on reintegrating into the workforce. St. Peter State Hospital had several programs that would assist many patients. St. Peter Hospital also worked with the Minnesota Security Hospital, which was also at risk for closing. The Minnesota Security Hospital provides specialized evaluation and treatment of the mentally ill and dangerous and sexual offenders. If either MSH or St. Peter were to be shut down, it would displace hundreds of patients, and the loss of jobs would be astronomical. The loss of these hospitals would have caused a massive blow to the local economy, and would end up limiting job experience and opportunities for the students at local colleges. Today, St. Peter Hospital still stands. Rather, they've changed buildings and work with a smaller number of patients. The Minnesota Security Hospital still stands, and both work together still today. The old building's wings have been torn down and only the center remains. Some old buildings can be found on campus, but most have been taken down due to age or simply not being up to code. This place has gone through many changes and many names, from Minnesota State Hospital for the Criminally Insane, to Minnesota State Hospital for the Insane, to St. Peter State Hospital. This place is a piece of history with both good and bad within its walls, but it's a staple to show how far we've come in the study and treatment of psychology.